Is it clear? If I say splenectomy, that means what? Removal of spleen, right? Make sense? So, ectomy is removal. Now, why? Sometimes we need to do this. You know, sometimes tonsils create problem. Swelling of tonsil occurs, right? And becomes painful. When the person swallows the food, becomes painful swallowing because of enlargement of tonsils, okay? Inflammation of the tonsil. And also, it becomes more problematic when ear pain starts. So, from tonsillitis, that ear pain, middle ear pain can occur. That is called otitis media, ear pain due to infection, otitis media. Okay. So now I am repeating again. Sometimes the tonsils become infected. Inflammation of tonsil occurs and tonsils become big, right? Enlargement of tonsil occurs because inflammation causes enlargement, you know that. Swelling. And that creates pain during swallowing, and sometimes that can go to the ear, that infection, and cause ear pain. So we need to remove, right? In that case, we need to remove that tonsil. So that's why we need tonsillectomy. So tonsillectomy is like broad term, any tonsil, removal of any what? Tonsil. Make sense? Tonsillectomy. But if I specifically remove the pharyngeal tonsil, that is called what? Adenoidectomy. Make sense? Because adenoid is pharyngeal tonsil. Okay. So now you know tonsillitis and why we need the surgical removal. Larynx is also called what I mentioned at the very beginning? Voice box, right? Now you tell me, if laryngitis, inflammation of larynx occurs, then what will happen? The voice will change, right? When the person will talk, you can tell that person got laryngitis. Is it clear? So, makes sense. So, laryngitis is another clinical condition. Inflammation of larynx. All these are easy, just itis. Laryngitis is the inflammation of the larynx, and that will change the voice because the vocal cords are located inside the larynx, and swelling of the vocal cord, inflammation of the vocal cord will change the sound. Now, as I have mentioned, most of the cases those happen, inflammation occurs due to infection, right? Bacterial or viral infection, sometimes it could be fungal infection. But if you use those organs too much, that will also cause mechanical inflammation. Make sense? Like if you talk too much, continuously, too loud, shouting all the day, right? So, lot of pressure on the vocal cord, right? So that will cause inflammation. If I rub your skin for a long time, what will happen? Hard, strongly, inflammation will occur, right? So you are rubbing the vocal cords, right? So that will cause inflammation. So excessive loud speaking can also cause inflammation, but usually occurs due to microorganisms, infections. Okay. We have talked about the pleura at the beginning, double layered covering around the lung, that is the pleura. Okay. So if inflammation occurs in the pleura, that is called pleuritis. Makes sense? Pleuritis. Inflammation of the pleura, covering of the lung. This is also called, it has another name, pleurisy. Okay. So pleuritis is also called what? Pleurisy. Okay. Inflammation of the covering of the lung. Okay. Pleuritis, when inflammation will occur, the layers will get thick and friction, when the lung will squeeze and expand, friction will occur between the layers. Okay? And that will cause pain during breathing. When you will breathe, it will cause what? Pain. And that can also cause fever. Fever is a common thing, right? You know, any kind of infection, fever is common. So, painful breathing. Another interesting clinical condition, that is called pneumothorax. If someone, puts a knife through the pleura, what will happen? A hole will be created here. Make sense? Or something pierces through the intercostal spaces here, that will rupture or make hole in the pleura. And what will happen? From outside of the body, air will suddenly get in, because the pressure is low here than outside. Okay, so suddenly air will get in and will fill the pleural cavity between two layers, and that is called pneumothorax. Okay, pneumothorax. Air will get in between the two layers. In pneumothorax, the problem is, you see, a lot of air has accumulated around the lung, right, in the pleural space. So the person will have difficulty in expanding the lung because pressure is high around the lung, right? So the person will not be able to inspire.
Collapsed lung?
Yeah, that is one way we can say collapsed lung, yes. The lung will not be able to expand, okay? Because a lot of pressure around the lung in that space, the air pressure is high, okay? So, yeah, that is one type of collapsed lung. Pneumothorax. Pneumo means air, thorax means chest. Air in the chest. Okay. So those are some clinical conditions in the lung. Where did I put my here? Okay. So we have talked about the diaphragm and intercostal muscles, right? Respiratory muscles. The normal respiratory rate in infants, newborn, it is very high. The respiratory rate is 30 to 60 per minute. Okay? And as you get older, the rate decreases. Okay? And in adults, the respiratory rate is 12 to 20. We say 16 average, okay? But ranges between 12 and 20. Now, if the respiratory rate increases higher than normal, that is called tachypnea. Sorry, TA, tachypnea. You remember tachycardia in heart? Tachy means fast, right? Increased number. So, tachycardia is increased heart rate, cardia. Tachypnea is increased respiratory rate. Make sense? Above 20. Increased respiratory rate. Dyspnea, another clinical condition. Distressful breathing. What kind of breathing? Distressful, right? Or labored breathing. You need to use a lot of force. Difficulty in breathing, right? Not smooth, soft breathing. Distressful or labored breathing. Okay? Labored or distressful breathing is dyspnea. Its name is telling you. Tachy means fast, distressful. Another one all of you know. Do you know this? Very common, right? Apnea. When apnea happens a lot? During sleep apnea, right? So very commonly we use the term sleep apnea. Apnea is A means absence. A means what? Absence. So apnea is absence of breathing. But is it permanent or temporary? Temporary. If it is permanent, death. Right? So we will not use apnea anymore. Right? We'll say dead person. So apnea is temporary cessation of breathing. I'm repeating again. Apnea means temporary cessation of what? Breathing. Temporarily stoppage of breathing. Okay. Apnea. Now the frequency varies person to person. Okay. Some people have more frequent, some people less. Now, what can cause apnea? There are two types of apnea. One is called obstructive apnea. Okay. Obstructive sleep apnea. Another type is called central sleep apnea. Okay, so obstructive apnea and central apnea. Obstructive apnea name is telling you, right? If something is blocking the passage of air, that will cause obstructive apnea. For example, when you sleep, what happens? The muscle in the back of your throat relaxes. You know, when you sleep, muscles relax, right? So also the muscle in the back of your throat relaxes, and that when the muscle relaxes, that moves forward and can block your breathing. Make sense? Relaxation of the muscle is like paralysis of the muscle. Sometimes accumulation of fat. Okay, accumulation of fat. If the person gets too fatty, you will see that problem. So accumulation of fat can also block the passage. Okay, that is obstructive. If you can remove that, that will take care of it. Central apnea is, you remember, I said that brain sends signal to the respiratory muscles. Remember that? To the diaphragm to move it down, intercostal muscle to move forward, right? So brain sends signal. So during your sleep, briefly, if your brain doesn't what? Send signal to the muscles, respiratory muscles, it will stop breathing. Make sense? Then it will start again. So temporarily, the brain will not send signal to the respiratory muscles, to your diaphragm and intercostal muscles, right? So that is central nervous system, brain, right? So that's why it is called central apnea. Okay. The people suffer from sleep apnea. When they wake up, they feel tired, okay? Fatigue. At the very beginning today, I mentioned why, right? You need oxygen, right? To produce what? Energy, ATP, right? So if you don't get enough oxygen, in your body, the ATP production will be less, the person's muscle and the body will be fatigued, okay? So we have already talked about apnea, tonsillitis, pharyngitis, laryngitis. Now let's finish by talking two others here. Rhinitis. Rhino means what?
Big and
Nose. Elephant, right? Big nose. Elephant has big nose, right? So, rhino. Rhinitis is the inflammation of your nose, nasal cavity. Make sense? So, allergic rhinitis is also called hay fever, which is one type of rhinitis that occurs due to allergy, not by microorganisms, not by bacteria or viruses. Most of the time, inflammation occurs by microorganisms, bacteria, virus, but some chemicals can also cause rhinitis. Can you name any chemical that can cause inflammation of nose, rhinitis?
pepper.
Yeah, pepper can cause that. Sometimes, that fume, industrial fume, right? That can cause, and dust can also do that, right? The air comes out from the car, right? Vehicles, that can cause prolonged exposure, right? Can cause that. So, that is rhinitis. Flu, also called influenza. Influenza is shortcut, commonly known as flu, right? You know that, all of you are very common. You take flu shot, okay, to prevent flu. So, inflammation of your nose or your pharynx or larynx, anywhere in the upper part of the respiratory tract, that is termed as influenza and occurs due to viral infection. So flu is a viral infection, okay, due to virus. But that virus could be many different types, okay, different strain of virus. Sometimes you listen, new type of virus has appeared, right? Like swine flu or this or that, right? So virus can change their strain. New strain of virus can be, created in nature. And that is a big challenge, right? It's a huge challenge for us. We make one type of, vaccine against like one type of virus, then another type evolves, comes out. So it becomes a big challenge worldwide All governments, all countries are facing that challenge. So you see, the small creature can create so much trouble, right? Huge amount of money we are investing for the vaccines. Okay, so yeah. Let's stop here. These are upper respiratory tract diseases. Upper respiratory tract diseases. In next class, we'll talk a little bit about respiratory, then we'll go to